So my name's Charlotte Bevan. I work on the PMRT collaboration as a SANS representative. And I'm going to speak today about a pathway to engaging parents in review, best practice, barriers, and parents' experiences. For those of you not yet familiar with SANS, we've been in existence for over 40 years, and our vision is for a world where fewer babies die, and when a baby does die, anyone affected receives the best possible care and support for as long as is needed. SANS's mission is threefold. It's to support anyone affected by the death of a baby, to work in partnership with healthcare professionals to ensure bereaved parents and families receive the best possible care, and to promote improvements in practice and support research to help reduce the number of babies dying. And according to that third and last aim, our key role as a member of the PMRT collaboration is to ensure meaningful parent engagement in review. So today's information and learning event is where I want to present the engagement of parents in the PMRT. So I'm going to outline today why engaging parents in review is important, best practice, a PMRT pathway and resources that have been developed, parents' experiences of this process so far, which we've gathered from a survey in 2021, and the barriers that clearly exist for healthcare professionals in delivering parent engagement, which we've collected from some of the anecdotes that we've heard from healthcare professionals during this year's online training. So why engaging parents in review is important, not just for parents, but for everyone. It's heartwarming to hear today about the decrease in babies dying since I'm going to start this one again. It's extremely heartwarming to hear today about the latest report from Embrace UK and the increasing decline in baby deaths since 2013. But it is still the case that 14 babies die every day in the UK, that 1 in 150 births ends in the stillbirth or neonatal death of a baby, and that affects the lives of 9,000 parents every year. The PMRT is essential in understanding which baby deaths are potentially avoidable. We have information about this from Embrace UK confidential inquiries run in 2015, 2017 and published this year. And we know that 6 out of 10 antepartum term stillbirths were potentially avoidable in that 2015 report. 8 out of 10 intrapartum related term deaths were potentially avoidable. And 1 in 2 baby deaths in twin pregnancies were potentially avoidable. And this represents the lives of literally hundreds of babies every year. The confidential inquiries review 2 aspects of care, both whether the death of the baby was potentially avoidable, but also whether harm to the mother was potentially avoidable. So care relating to the mother. And by that, what it means is care, her bereavement care, her care postnatally after her baby died, and her engagement with the review process. What we know from the confidential inquiries that was published this year into twins from pregnancies in 2017, from those 50 twin pregnancies in 2017, is that only 1 in 5 deaths had a review, that the quality was poor, and that parents were not engaged. And the result of this is that 64% of mothers were affected by the poor care they received after their baby died. Parents' engagement in review is key because the review is the narrative of their child's short life. Over the 40 years that SANS has been supporting parents, we know that parents feel several emotions after the death of their baby, very typically. Guilt is one. Was it my fault? Distrust is another. Was it someone else's fault? They want to plan future pregnancies. They want to know if something was wrong with their baby and will it happen again. They want something good to come out of something bad. So if something is learnt from the review of their baby's death, then it means that a lesson will be learnt to prevent the same thing happening to another parent. And also it's important because engaging parents has the potential to prevent long-term harm for parents. To illustrate what I mean by long-term harm, I want to introduce you to Chloe Baker. She approached SANS 2 or 3 years ago, and she asked me whether the PMRT could be used retrospectively to review the death of her son, Solomon. He had died during a low-risk pregnancy when she was 34 weeks pregnant, and when one evening she was feeling sick and had diarrhea when out with friends, when she called her unit, she was told to come in. He died during her labour, and this is the review that she received after he died. The frustration at having unanswered questions and this sort of shorthand paragraph, not in plain English, to explain why he died, meant that 10 years later, she was still suffering and asking herself questions about what happened that night, and indeed suffering to the point where she couldn't, in fact, go to work. I'm going to let Chloe pick up the story from when she was in hospital the night that Solomon died.
Then I can remember being taken on a trolley down to the operating theatre, and then I can remember anaesthetist on my left and the doctor above me looking at the anaesthetist saying, "Tell me when, tell me when, tell me when." And then the next thing I know, however many hours later, I'm coming to, and I can remember reaching down and saying to Simon, "I think my waters have broken." And that's when Simon had to tell me that he didn't survive. And yeah, and then it started. I just wish we could have had a debrief, one where we could all learn, where we could have figured out what happened. Because he was fine. He was absolutely fine before going into hospital. I was absolutely fine. I just had a bit of sickness and diarrhea, but something happened. Something went wrong. We've never had a written explanation or of that paragraph. I can't explain because it impacts me daily with my job, my patients as a parent, my emotional state. Sometimes it can hit me in the middle of a supermarket. It would make a huge difference to find out why. And the changes that are now in place, I think I'd find a lot of comfort in knowing that this wouldn't happen again because X, Y, and Z are in place now. And unfortunately, it does still happen, but this is in place to help those parents that do go through this now.
But Chloe's story is not a one-off. We know from repeated reports, national reports over the last decade, that this is a recurring theme. The Ockenden report, which published emerging findings in 250 cases over the last 20 years, also raised this issue. Repeatedly, families have told us of two key wishes. Firstly, they want questions answered in order that they understand what happened during their maternity care. Secondly, they want the system to learn so as to ensure that any identified failings from their care are not repeated at the trust or occur at any other maternity service in England. Engaging parents in review is important not just for parents, but it actually may improve the quality of the review process itself. And the reason for that, of course, is that parents are at the centre of their care. Their perspectives may add to the clinical picture. The parents' study in Bristol, which looked at a gold standard for engaging parents in review, found that parental engagement focused the review meeting and therefore promoted an open and learning culture. And of course, currently, engaging parents in review is Action 1C of the 10 maternity safety actions within the CNST Maternity Incentive Scheme for Trusts in England, which is now in its 4th year, and which states that 95% of parents are told about review and their perspectives and questions sought, and a key contact maintained through delays. So how to engage parents, a best practice pathway and resources which have been developed by the PMRT. And this was done by a working group, including the parent study team from Bristol, including the Being Open pilot representative, Elodie Murdoch, representatives from neonatology and midwifery, and myself chairing it. And I would like to say also that 50% of the people on this group were in fact also bereaved parents, including some of the clinicians. The PMRT parent engagement pathway that we developed was a co-production of parents' voices, things that SANS had heard over the many years we've been supporting parents, and learning from evidence, the parents' study in Bristol, and best practice, the NHS Lothian being open pilot. To highlight just how significant the PMRT values parent engagement, it is the first question that the PMRT tool asks you. It's around parents' engagement. Were they asked about their perspectives of their care? When were they sought? And what were those perspectives? And if that isn't done, if you do not engage parents in the review process, it generates an issue within the tool that requires a smart action. So the parent engagement flowchart that the working group developed outlines a week-by-week process of communicating and listening. It's essentially a communicating and listening exercise. And week 1 is key because it's the early days before hospital discharge, the early hours and days before hospital discharge, when you're providing bereavement support in the maternity or neonatal unit, and where you have to approach parents and tell them about the review process and offer them the opportunity to engage with it by asking questions or giving their perspective. There's a parent information leaflet that explains the process and the number, and all parents should be given the name and number of a key contact before they're discharged home. Coming to week 2 and 3, the key contact will need to reapproach the parents if the parents have not chosen to already engage in the process. To establish parents' preferred method of engagement, is that by post, by email, by phone, or if possible in a face-to-face meeting. Encourage parents to consider their questions and perspectives before following contact is made, and send them a follow-up letter about the review and a feedback form. And then the flowchart goes through to weeks 3 to 16, just explaining some of the other processes. The flowchart, we hope, is something that units might print off and laminate and stick on the wall of their unit. But what's important about it is that it doesn't capture everything, so that we developed some flowchart notes to support all the variations in reaching parents that healthcare professionals might experience, and some of the challenges that exist there. So if, well, first of all, and importantly, it's essential that discussion about the review is not done by a junior member of staff, but by a senior member of staff. And that before parents go home, that they're given a parent information before discharge leaflet. And we've created that within the parent engagement materials that are on the PMRT website. We describe what a key contact person is, what their key responsibilities are. And we also describe that if you can't reach parents within week 2 to 3, then we've created a template letter for being able to reach parents when you can't reach them. What should that letter look like? What should it sound like? We've also created some feedback form as triggers for questions that parents might have, because it may not be immediately intuitive to them what you mean by engaging and involving themselves in the review by giving their own perspectives of their care. So the feedback forms are essentially, they don't have to be filled in, but they're just ways of triggering thoughts for parents about the fact that you are interested in hearing if they have any views or concerns or questions about their care during pregnancy, their care during the birth of their baby, the care that they received after the stillbirth of their baby, or the care that the family received after the death of their baby. And the template letters that we've created are important because the language you use will be remembered by parents for a long time. So sensitive, compassionate, gentle language is an incredibly important process of engaging with them. If they feel that you're not on their side, they will disengage. And also because it's important to keep in touch when there are delays. So these are all sensitively worded letters that will speak sensitively and compassionately to parents about the process so that they will feel included, so that they will feel that you are consistent in your communication with them. Again, this is an issue of language that was brought up by the Ockenden report. The review team has also seen correspondence and documentation which often focused on blaming the mothers rather than considering objectively the systems, structures and processes underpinning maternity services at the Trust. And this is an example of that, a follow-up letter sent after discharge which states, "If you would like to come and have a chat with me about the death of your baby," where there are no words of condolences or sympathy within the body of the letter. So we've also come up with a plain English guidance for review summaries within the PMRT parent engagement materials. And this is just so that you can communicate what has happened, what occurred in the review process, what the findings are in plain English, that doesn't act as a barrier to parents' understanding. So, for instance, antepartum. You had an antepartum hemorrhage, that would be the clinical term, but you can say that in plain English. You had some bleeding before labour started. You know, we see letters where parents' baby is described as a female fetus. You really cannot call the baby a female fetus unless that's what the parents describe their baby as. It's a little girl, it's a baby daughter. SANS has also produced a saying sorry is not a blame game statement, because we have noticed over the years how important the word sorry is. Parents consistently tell us that what they value hearing from a friend, a family member, or a health professional is the word sorry. I am sorry to hear about your baby. I am sorry your baby has died. And I think there is a reticence maybe on the part of some healthcare professionals to say sorry because they think that it is admitting legal liability for what has happened. But this is not the case, and that is set out by legislation in parts of the UK. Saying sorry is not an admission of liability. It is simply an expression of human empathy and compassion at a devastating time in a parent's life. So those are the parent engagement resources which we developed in 2018, which were rolled out in 2019. And we were very keen at SANS to understand whether that had changed parents' experiences of engaging in the review process. So you will have heard today in the PMRT third annual report, there has been huge improvements reported in the number of parents who are told about the review process and whose perspectives are sought. 90% of parents are now told about the review process, according to the PMRT third annual report, and 84% of parents are asked if they'd like to share their perspectives of their care. 40% of parents do not raise questions, according to the report. But what we're curious to know is whether the good engagement you imagine as health professionals as having been delivered is actually what is experienced by parents themselves. So we ran a survey earlier in spring this year of parents' experiences of review since the PMRT parent engagement materials were available in 2019. And we had 278 responses. They were mostly mothers, and there was quite a good diversity among them in terms of ethnic representation. 62% of them had had a stillborn baby, 22% had had a baby who died shortly after birth, and 16% had experienced a pregnancy loss between 22 and 24 weeks. It wasn't that 90% of parents, as the PMRT third annual report tells us today, were told about review. It was 6 in 10 parents in our survey who were told about review. And interestingly, it was 1 in 5 of them who did not entirely understand what they were being told when they were told about review. And obviously this is a small subset of 278 parents. It's not the whole cohort of parents reported as having been engaged in review over the course of the year, but it is interesting to see the difference in how parents potentially experience the review process and what's reported within the annual report. One parent said, "I never knew about a review until I reached out at breaking point to a bereavement midwife in my own area. I've since completed the review, but still not heard much. It would just feel nice to be listened to and cared for. We have no doubt that our care was amazing and that the hospital did everything they could for our baby. However, a review would provide some kind of closure. I also wanted the review to look at why it happened and gives us some insights." And that's a mother whose baby died neonatally in Scotland last year. 4 in 10 of our parents never received a letter summarising the review and why their baby died. And this is what they said. "I'm not certain if they received my questions. I'm also confused as I requested a full report to my house after being asked by the bereavement midwife if this was what I wanted, and I've since been told I won't get one. Also, I've received a letter addressed to only me for a hospital appointment which nobody can tell me what it's about." And then, of course, there are aspects of good care. It was sensitively worded, it explained everything to me in terms I could understand, but it also included all the official documentation that went alongside this. Generally, parents were waiting a long time to receive the review findings. 3 in 12 parents waited 4 or more months, and 1 in 12 waited more than 6 months. I was told there would be a review and it would take 8 to 12 weeks. I received my appointment nearly 5 months after our daughter died, but with 0 contact. Would be helpful if they just sent a letter to say they are waiting on results, or an email, something to acknowledge the wait. So perhaps not surprisingly, feeling listened to was strongly associated with parent satisfaction with the review process. So 8 out of 10 parents had questions. 6 out of 10 of those parents who had questions felt completely or mostly listened to, and 1 in 10 didn't feel listened to at all. 4 in 10 parents said they were not or only quite satisfied with the review process, and 6 in 10 said they were completely or mostly satisfied with the review process. So while most of the comments we had were largely negative about the review process, there were some good examples of care. And these are exemplified by the things that mothers said. I feel like every care has been taken to ensure I have all the information needed about my baby. I still don't have an explanation as to why he was stillborn, but have been assured that there will be more support available to me during a next pregnancy if I'm lucky enough to have another baby. The hospital was brilliant, and we were given lots of opportunities to ask questions. Even now, almost 5 whole months on, we feel we could call them to talk about things again. And this is sort of one of my favourite quotes because it's just so simple and it sums it up effortlessly. The review made us feel that people cared, that it wasn't just one of those things. So in our own words is the report that we have published that will be available online tomorrow that summarises the survey, and you can find it at this link here. You'll find a full report, a thematic analysis in detail by Joanne Dickens from the University of Leicester, who very helpfully supported us, and the best practice points that we have taken from some of the things that parents said, and that are reflected in this infographic to the right about care being timely, informed, parent-centred, easy to access and flexible, compassionate and gentle, open and honest. So just as there is a discrepancy between the care that's imagined as being delivered and the care that parents experience themselves, there is also a discrepancy in the care that healthcare professionals would like to deliver and some of the barriers they find to delivering it. We have been delivering some parent engagement training online this year, from June 21 this year to March 22 next year. These will be free. It's a 90-minute online webinar. It happens every 2 months. It's facilitated by me and supported by SANS bereavement care trainers. So far, it's attracted a mixture of clinicians and people who have different roles in units, and only a handful, sadly, from neonatology, but we hope to improve that. I've also presented it at 2 Saving Babies' Lives Care Bundle Reducing Stillbirth events. So in all, we've probably engaged about 100 people, and our next webinar is on the 17th of November. And if you want to join, please do go and find out more about it from that link. We usually don't advertise it until about 4 weeks before we actually have the event. One of the useful things that we get out of these training sessions is because we have breakout sessions, we get feedback from healthcare professionals about some of the barriers they experience in delivering parent engagement. And these are some of the issues that have been risen. These are all around support and process. There's not enough investment in the process by the trust. There are delays. The post-mortem results are taking up to 16 weeks. Obviously, that delays the actual finalising of the review process. Everybody mentions time and resource and the fact that there are pressures on the bereavement midwife, who's often also the PMRT lead, so that she or he is being left with a huge burden of responsibility in this area. And some people have raised the issue that the NHS England maternity incentive scheme can have a negative impact on quality because there is a drive to just get it done. And therefore, the quality and robustness of the review process and the engagement of parents may not be as good as it could be. There are barriers experienced by healthcare professionals just in reaching parents too, of course. And some healthcare professionals, and this is a paraphrase of what somebody said, say that you know in the first few minutes when you walk into a room whether it's going to be easy or difficult to speak to that parent. There's a kind of sense of anxiety as you open the door. And a lot of healthcare professionals talk to us about, what do you do if parents don't respond after several attempts? At what point do you give up? How long do you wait? If parents say they do want to engage and they do have questions, but you just have to get on with the review and you still haven't heard from them. How do you collate feedback if it comes in multiple formats? And increasingly, because engagement has improved, then parents are engaging by phone, by text, in emails at different times. And this can be very overwhelming for bereavement leads who are generally the key contacts that parents are communicating with. And also, how do you ensure that you're giving equal opportunity to everybody to engage? And particularly those groups who are potentially most at risk of poor outcomes. So that's Black, Asian, ethnic minority families and families who are living in the poorest communities. So we have summarised from what we've heard from parents, from what we've heard from healthcare professionals about the barriers to engaging parents in review, we have summarised what we think are the most important recommendations in our report in their own words, I'm going to start that one again. So with the wealth of information that we have collected from parents through our survey and from some of the things that healthcare professionals have told us, we have summarised some recommendations in our report in their own words, which, as I said, it will be available tomorrow on our website. And those main recommendations are that parent engagement in review should be mandatory for all local hospital review processes across the UK and should follow good practice as outlined by the PMRT and by SAN's 6 principles. That quality of parent engagement in review should be monitored and evaluated. That quality of parent engagement in review should be monitored and evaluated. That there should be ring-fenced funding to secure staff time to support parents throughout the review and to release staff to participate in reviews and to participate in training. We had a training event the other day, which was bespoke. It was booked in with us. Only 4 healthcare professionals turned up, and we were expecting at least sort of between 10 and 20. So that was very disappointing, and I'm sure people were just very busy. And also that evidence and best practice needs to be brought together to establish what is truly independent external review, because clearly this is an issue that will generate not just parents' confidence in the process, but as you will have heard from the PMRT annual report today, also has the potential for making the review process more robust in identifying lessons. And of course, there will be funding needed to ensure that external review panel members are able to be present on every review panel. So to illustrate what it feels like for parents when there is time and resource to engage them in the review process, and the process is meaningful, it's parent-centred, it's compassionate, this is what it felt like at least for Adelia and Edward, who were part of the parent study in Bristol.
What was really good is that we had time to think about the questions we wanted to ask, and then we had the midwife involved in the study that came to our home to discuss those questions and take our points. Obviously we sort of review the events a million of times in our heads, so going through every step of before, during and after what happened to us with our baby. It was really good to go through that with a very friendly midwife.
So you found the home visit was important?
Yeah, definitely. Yeah.
Not having to go back to hospital where it all happened in order to meet them was very good. We did go back the following day, But of course, you've got the memory of what happened the day before, and if you have to go back 2 months down the line, again, it brings back the memory. So, it's just good to come and see for them, and it's very kind for them to come and see us as well at home.
What was good is that we had a letter with coming back with the full answers to the questions we asked. So things we maybe thought could have been done differently. If, for example, the ambulance could have come quicker, or anything that could have. So we had answers to all the questions. So the midwife involved in the study really captured our questions, and we definitely had the answers to those questions that were taken to the board of professionals. So we didn't know all that process, but at least we knew we were involved in that process.
So thank you for listening to me today. We have created on the SANS website a location for you to find not just the review survey, but also some tools that we have developed, which we think and hope will support you in delivering meaningful parent engagement. It's at Engaging Parents in Review. And it doesn't just include a link to the review survey findings, but also podcasts and animation and an outline of our 6 principles of meaningful engagement. And we hope that they're really helpful to you. And lastly, not just to thank you for listening to me today, but also to thank the extraordinary parents that SANS supports, but who also support us. This is Chloe Baker, who I introduced you to earlier, and this is her last weekend fulfilling a ambition since Solomon died, which is to run the London Marathon in his name. And this is her with her 2 other boys and her husband, Simon. Thank you so much. And thank you too to Jenny and Liz for inviting me, the PMRT and Embrace UK collaborations for inviting me to come today to speak on behalf of SANS and for involving SANS in all this incredibly important work. The animation I just mentioned, of course, you can link to it from that link I've outlined there. And there will be a set of these slides for you to look at all the links that I provided in this slide set, but I'll also improve that for the slide set that you receive so that you can link to our National Bereavement Care Pathway and all the other resources that we produce. But I did think, since it's hot off the press today, I would share the animation with you. It literally got finished this morning and signed off this morning by my comms team. The animation I'm talking about is one that we had some external funding for, and we've created 2 animations with that funding. One is around grief, but this particular one I want to share with you today is around engaging parents in the review process. And what we wanted to do was sort of outline what we mean by that. What does it look like? What does it feel like? What does it feel like for parents? So it's really an exercise in generating an understanding of what we mean by engagement.
Earth. They will have a unique perspective of everything that has happened to them. Death of their baby. Following the death of a baby, parents will be grieving and in shock. Many parents will be weighed down by lots of questions. Understanding the cause of their baby's death will be important, not least because it may have implications for a future pregnancy. Not knowing what happened to their baby may have an impact not just on parents but on siblings and the wider family too. That impact may be lifelong and affect their ability to cope with everyday life. Parents will need support to understand what review means and to know that they can ask questions and share their own version of events. They will need guidance from healthcare professionals so that they have the confidence to know no question or concern is irrelevant. Even small details can play on a parent's mind for a long time and are an important part of the bigger picture. It may be too soon for them to think of all the questions they have now. Giving them written information to take home about the review process and how they might be involved is important. Answering parents' questions and giving them the chance to tell their version of events as part of a robust hospital review supports them and their families growing through their grief. And if things have gone wrong with hospital care, an open and honest review will mean fewer parents resort to litigation to get clear answers. Clinicians who engage parents in review say they provide unique insights into where there are gaps in care, that would otherwise be missed by the review team. Listening to the voices of parents not only helps parents and families move on, it improves care for future families and saves lives.